This is a new crisis in the middle of a crisis. As of tonight, North Carolina has outbreaks in more than 30 nursing homes and 10 more at rest homes. Looking closer at our immediate area, there are outbreaks in at least 13 facilities, and those are just the ones we know of. Real information has been hard to come by at times, so all night tonight, our Joe Bruno has been focused on finding out why more details aren't being made public.
If you have a friend or a loved one in a nursing home in Mecklenburg County, you should know this. If there's a COVID-19 outbreak in one of these facilities, the health department is not letting people know about it. It will be up to the facility to decide who to tell and when. Some of our neighbors are finding out the hard way.
When I drove up there, that's when I found out.
All Kathy Shenette wanted to do was drop off some clothes and a walker for her mother, who was fresh off of hernia surgery. When she arrived at Autumn Care in Cornelius, she was greeted by an employee saying put them away because 2 people have already tested positive for COVID-19.
And I said, second, when did you have a first? No one notified me that there was a first.
About an hour after that conversation, Shenette found out her mom had a fever that had skyrocketed. Test results this week confirmed coronavirus.
It was like a kick in the gut, totally. So it was really, and she's got COPD, so she's like a poster child for the virus, for not making it, really. And that's what's so terrifying.
Including her mom, Shenette says at least 4 cases of COVID-19 have been tied to Autumn Care in Cornelius. If not for her telling us, we would have had no idea, because Mecklenburg County is refusing to identify nursing homes and assisted living facilities with outbreaks. Health Director Gibby Harris said the county has been working with these places to restrict visitation and limit access so they don't pose a threat.
If we were to have a large outbreak where we may have more concern about that, we might very well release that name. But at this point, if we released an outbreak, we're releasing the address of individuals, and that's not typically what we do in public health unless there is a public health need to do that.
But there have been large outbreaks and the county has kept quiet. The social at Cotswold, for example, confirms 15 residents and 1 staff member have tested positive. It's not like Mecklenburg County isn't allowed to release the information. Other neighboring counties are, like Union, letting us know about outbreaks at Monroe Rehabilitation Center in Woodridge. Rowan County informed the public about an outbreak at the Citadel, the caseload in the dozens. And Cabarrus County told everyone about Five Oaks Rehabilitation, where at least 67 people have tested positive. Former Cabarrus Health Alliance Director Will Pilkington says that's the way it should be.
Just as health departments share their great sanitation grades for these facilities, I think they should be sharing the information that they have about outbreaks within those facilities. We've always done that. When all of us are giving different information and different communication styles in an environment like this, it just breeds public mistrust.
And as the daughter of an elderly woman with underlying health conditions now battling COVID-19, Shenette agrees.
I think that it should be that people should know. I mean, if you're going to put your family member in a facility, you need to know that there's people infected in there. The whole thing has been very disheartening. I just really thought that she would be safe there.
Mecklenburg County Health Department insists they will not release the name of these facilities unless there is a public need to. They have not responded to my questions asking how a large outbreak is defined. But you can be sure this is something we're going to continue to stay on top of because so many people have asked us to.